Did you know that a heart attack can happen without you realizing it? That's right. Many people suffer a silent heart attack and don't even notice. In this article, we will reveal 6 scary signs that may indicate a silent heart attack but are often ignored. Pay attention. This could save your life or someone you love. Don't miss this video because you will discover all the signs that may be going unnoticed right under your nose. Did you know that between 20 to 45% of heart attacks are silent? That's right. When you think of a heart attack, what comes to mind? Most people imagine dramatic movie scenes where someone clutches their chest tightly, has difficulty breathing, and suddenly faints or something worse happens. But reality isn't always like that. A silent heart attack presents subtle, minimal, or even no symptoms. It may seem strange that a heart attack happens without the person noticing, but it's true and justifies the name silent heart attack. And that's the theme of today's video. Believe it or not, your body usually gives some subtle signs before a silent heart attack. Want to know more about what a silent heart attack is and what are the 6 signs you should be aware of? Then watch until the end. This video is very important and can save your life or the life of a family member or loved one. We know that a heart attack is the leading cause of death in Brazil and worldwide. In our country, cardiovascular diseases kill about 400,000 Brazilians per year, according to data from the Brazilian Society of Cardiology. So, pay attention. Before continuing, like the video to help us reach a record number of likes on the channel. The more likes, the more YouTube recognizes the video as relevant and distributes it so that more people become aware. Subscribe to the channel if you haven't already and activate the bell to receive notifications. Share this knowledge with your friends and family. See how alarming. Less than 5% of the Brazilian population knows how to recognize heart attack symptoms, the leading cause of death. Imagine how many people know about silent heart attacks. Almost no one. So share. Many lives can be saved with your help. And tell me, have you had a heart attack? Do you know someone who has? Which part of Brazil or the world are you from? Write it in the comments. Let's go. Is a silent heart attack different from a normal heart attack? Is a silent heart attack different from a normal heart attack? Well, they have the same basis. What differentiates them are the symptoms or the lack of them. The heart is a muscle that needs blood rich in oxygen and nutrients to keep pumping blood throughout the body. In a heart attack or myocardial infarction, there is an obstruction in the blood flow in one of the arteries that supply the heart, the coronary arteries. The formation of fatty plaques inside the arteries, called atherosclerosis, is the main cause of a heart attack. The person already has the fatty plaque that, for some reason, ruptures. Could be due to stress, cold, intense physical exercise, or a lot of effort. When the fatty plaque ruptures, platelets, which are part of the blood, try to stop it, resulting in the formation of a clot. But since it is inside an artery, which works like a pipe, this clot grows and clogs, causing a partial or total blockage of the artery, resulting in a heart attack. The heart muscle suffers from the lack of blood, which carries oxygen and nutrients to the muscle, and the cells start to die quickly. The severity of the heart attack depends on where the obstruction is. Is it in a main artery, in the left coronary trunk, in the anterior descending, or in a secondary artery? Is it at the beginning of the artery or at the end? All this determines the severity of the heart attack. Of course, how quickly you get to the emergency room or the time it takes to be treated also influences the degree of injury. And this is the first important point about the silent heart attack. Why is a silent heart attack serious? Since the person does not show symptoms or has only a few symptoms, they simply do not realize what is happening. This is problematic because it reduces the likelihood that they will seek medical help and receive the necessary treatment in time, which is crucial to avoid severe damage to the heart. What are the symptoms of a classic heart attack, also known as an acute myocardial infarction? According to the Brazilian Society of Cardiology, less than 5% of the population knows how to identify heart attack symptoms, so it's worth remembering. Here are the 7 classic symptoms. 1. Chest discomfort. It lasts more than a few minutes, usually more than 5 minutes. It is a prolonged and intense pain that may go away and then come back. The pain can be described as pressure, heaviness, tightness, or burning. This pain occurs because the muscle is dying. Imagine the pain of a cramp, and now think of the pain caused by the death of a muscle. 2. Radiating pain. In addition to chest pain, a person may feel discomfort in other areas of the upper body, such as pain or numbness in the left arm, neck, back, jaw, stomach, or both elbows. 3. Shortness of breath and difficulty breathing. The heart is suffering and not pumping blood properly. 4. Cold sweat and paleness. Due to pain and discomfort, the body releases adrenaline, causing a cold and sticky sweat and making the person pale. 5. Nausea and vomiting. This occurs due to the reaction of the vagus nerve. 6. Dizziness, which can even lead to fainting. 7. Anxiety. The adrenergic discharge makes the person feel anxious, with a sense of impending doom. These are the 7 classic symptoms of a heart attack. And in the case of a silent heart attack, if there are symptoms, the bigger problem is that they are usually confused with less serious health problems. This confusion increases the risk of death from coronary disease. A silent heart attack may not cause chest pain, numbness, or shortness of breath. To clarify, a silent heart attack can occur without symptoms, with minimal symptoms, or with unrecognized symptoms. According to the American Heart Association, of the more than 800,000 annual heart attacks in the USA, about 170,000 are silent heart attacks. It's an impressive number. What are the risks of a silent heart attack? A silent heart attack has more risks of heart failure. People who do not go to the hospital after a silent heart attack end up suffering more heart damage, increasing the risk of heart failure by 35%. Stroke. Silent heart attacks increase the risk of stroke due to the formation of clots, heart dilation, and increased atrial fibrillation. Another heart attack. The lack of perception of having had a heart attack increases the risk of another heart attack. People who have had a silent heart attack are 3 times more likely to die from coronary artery disease. Sudden death. A 2018 study observed that about half of the survivors of a silent heart attack died within 10 years after the incident. What are the risk factors for a silent heart attack? The risk factors for a silent heart attack are the same as for a classic heart attack, including atherosclerosis, caused by various factors. Smoking. Smoking significantly increases the risk. Diabetes. Attacks the nerves silently, causing tingling in the feet or even loss of sensation in the feet and other parts of the body. High blood pressure contributes to the formation of plaques in the arteries. Overweight and obesity increase cardiovascular risk. Sedentary lifestyle, lack of physical exercise is a major risk factor. Cholesterol. Both low HDL and high LDL, bad cholesterol, and elevated lipoprotein A. Inflammation can lead to the development of plaques in the arteries. Age. Postmenopausal women over 55 years old or men over 45 years old are at higher risk. Family history. Having relatives who have suffered heart attacks or strokes increases the risk. In particular, it is important to highlight diabetes. It silently attacks the nerves, increasing the risk of problems such as tingling or loss of sensation, not only in the feet but in other parts of the body as well. Diabetes can affect the nerves of the heart, increasing the risk of silent heart attack in diabetics. The pain they should feel simply is not perceived, as if the heart were anesthetized. Pain serves as an alarm indicating the need to go to the hospital. Symptoms can be so mild and brief that they are often mistaken for minor discomforts and ignored. Don't ignore them. 1. Fatigue. The person may feel fatigue or an undefined malaise, attributing it to overwork, lack of sleep, or age. Women may think it is a passing virus. If you have risk factors, fatigue may be being misinterpreted. Do not underestimate it. Go to the emergency room to do an ECG and check cardiac enzymes. Can save your life. 2. Mild chest discomfort. Unlike the classic heart attack, which causes intense pain, most silent heart attacks involve mild pain or discomfort in the center of the chest. It is often mistaken for gas, heartburn, reflux, or indigestion. If something doesn't feel right, seek a doctor. 3. Sweating. If you are sweating for no apparent reason, such as excessive heat or physical exercise, it may be a sign of a silent heart attack. This is especially important for diabetics. Seek medical help immediately. 4. Shortness of breath. If you suddenly feel short of breath after minimal effort, such as climbing a few stairs, it may be a sign that the heart is not pumping blood properly. In a silent heart attack, shortness of breath may occur without chest pain, being more common in women. This symptom, disproportionate to the effort made, can be an alarm. Dizziness or vertigo may also occur, which can lead to fainting. 5. Nausea. Often attributed to indigestion, a virus, or the flu. Nausea can be a sign of a heart attack, especially if accompanied by cold sweats, chest discomfort, or fatigue. 6. Discomfort in other parts of the body. Besides the chest, discomfort can manifest in other areas such as the arms, neck, jaw, or back. Being attentive to these signs can make all the difference. If you notice any of these symptoms, especially if you have risk factors, seek medical attention immediately. How to recognize a silent heart attack. A silent heart attack can manifest with mild discomfort, different from the classic heart attack, which can be felt in the jaw, stomach, neck, back, or as a pressure sensation. Do not ignore these 6 symptoms and seek medical help immediately. There are cases where patients go for routine checkups and, upon doing an ECG, discover they had a heart attack without knowing it. This is identified by the presence of a scar or fibrosis area in the heart, something that cannot be reversed but can be treated properly if identified in time. Identifying a silent heart attack is difficult because the symptoms are vague, but it is crucial to pay attention to these signs. How to protect yourself from a heart attack. If you have already had a heart attack, regular consultation with a cardiologist. It is essential to monitor heart health. Medication. Continuing to take prescribed medications is fundamental, even if you have improved your lifestyle. Medications with proven scientific evidence reduce the risk of new heart attacks. If you have not had a heart attack and want to prevent one, attack the risk factors. Many heart attacks can be prevented with lifestyle changes. Quit smoking reduces the risk of heart attack by 30%. Control blood pressure. Keep it at 120/80. Control diabetes. Keep blood sugar well controlled with glycated hemoglobin below 7. Healthy eating. An adequate diet is crucial. Best diet to prevent heart attacks. A common question is, what is the best diet for those who have had a heart attack? Low-fat diet or Mediterranean diet? In May 2022, a study published in Lancet involved over 1,000 people with established arterial disease. Half followed a low-fat diet and the other half followed the Mediterranean diet. The Mediterranean diet, rich in olive oil, nuts, and fatty fish, sources of healthy fats, proved to be superior. After 7 years, those who followed this diet had significantly fewer heart attacks, strokes, and related problems than those who followed the low-fat diet. Benefits of the Mediterranean diet. Olive oil, nuts, and fatty fish, sources of healthy fats. Results after 7 years. Fewer heart attacks and strokes. Yes, the Mediterranean diet can be expensive, but medications are also costly. Investing in your health is worthwhile. Other tips to prevent heart attacks. Reduce cholesterol and triglycerides. Use diet and exercise, and if necessary, medication. Physical exercise. At least 150 minutes of moderate physical activity per week. Good quality sleep. Sleep between 7 to 9 hours per night. Weight control. Lose weight if you are overweight or obese. Social interaction. Build connections and make friends, as loneliness and social isolation increase the risk of heart attack by nearly 30%. Cardiological checkup. Have regular exams. If you are at high risk of heart attack, more detailed exams like coronary angiography may be recommended to evaluate the arteries from within. I hope you enjoyed the video and learned new things. Share this information so more people can benefit. Many lives can be saved by spreading this knowledge. Video recommendations. The danger of drinking little water. Diseases prevented and cured with proper hydration. Coffee. Is it good or bad for the heart? Remember to subscribe to the channel and share this video to help more people. This small act of kindness can save a life. See you in the next video.